guys, welcome back. This video is going to be an explanation, or at least a very brief explanation, of EMDR, which is eye movement desensitization and reprocessing. It is one of the 3 DoD endorsed treatments, has been evidence-based, heavily researched, and is heavily utilized by the Department of Veterans Affairs and clinicians worldwide. So we're going to talk a little bit about the background, the how and why it works, and the purpose for using it. So EMDR was developed in the late 80s. It is a competitor to prolonged exposure and cognitive processing therapy, which we'll talk about in separate videos. I utilize EMDR on a daily basis because I believe it to be the most effective and the most protective for my clients or veterans and for myself. So EMDR works off of the theory that our events of the day or our traumas are processed through REM sleep cycle. So we work to replicate REM sleep cycle in my office through eye movements. Now, some of you have issues, seizure disorders, multiple sclerosis, where you feel like or can't tolerate the eye movements. For that, we have tactile pulsators. We also have tones, or we can utilize it without any stimulus at all. The theory is that trauma is stored in our nervous system. So in order to actually work with the trauma and the distorted thinking patterns, we have to calm our body down first, which means that we work with the physical sensations of nausea, temperature, numbness, or tingling, and we work to calm those things down, and then we can move to the frontal lobe where we can actually work with and reason with our cognitive thoughts or distorted thinking patterns. Distorted thinking patterns would be things like, I don't deserve to be happy, I deserve to be punished, I'm not safe, I can't trust anyone, I should have known better. And so many times we've discovered that those develop as a result of trauma. That's one of the most common symptoms. So once we work to calm our body down, we then move to the frontal lobe where we can work with those thought patterns. But we first have to work with our physiological sensations, because every single time we have a direct correlation to the trauma or an indirect correlation to the trauma, we experience those physiological disturbances. Physiological sensations would be things like nausea, even vomiting, high blood pressure, sweating, red ears or red face, jaw clenching, the pressure that we feel in our chest, and this can occur directly or indirectly of the event. So in other words, we may have a direct correlation like I was mugged in the Walmart parking lot, therefore Walmart gives me palpitations, or I was mugged in the Walmart parking lot and now every parking lot or being in the vehicle gives me nausea or high blood pressure. So when we think about dealing with those, EMDR is an exceptional trauma treatment. It absolutely works wonders for many of you because little to no disclosure is required. So for those classified events that we can't necessarily talk about, EMDR is an exceptional way to work around that. And I have done this repeatedly over the years. So much so that I had one gentleman who we knew, I knew he was in North Africa and there was burning jet fuel, and that's all I knew. And we successfully took nightmares from nightly occurrences to 1 time a month or less occurrences, which is simply outstanding in my opinion. They may never go away, but they can be significantly reduced. So EMDR is also beneficial because we can cover multiple traumas at one time, which you cannot do with the other two. You have to select one, and basically you can do one or maybe a second one, and after that you're not supposed to do the protocol anymore. With EMDR, we can hit many traumas with one stone. Many of you have what we call complex trauma. You have multiple deployments, major losses, or even personal losses like children, or illnesses in your family, or even illnesses in your own body that you're having to deal with. So those things are incredibly challenging to work with in the other 2 protocols. In fact, not even challenging, they're not even workable in the other 2 protocols. They're only workable in EMDR. Lastly, we can build what we call future templates for occurrences in the future. So let's say that we need to practice or want to be more comfortable with going to the grocery store. We would take the concept of going to the grocery store, work on that, build confidence and what that would look like, and then you actually go execute that event. And it should be, if all things go properly, much easier on you. As for performance-based EMDR, it has exceptional outcomes, and I've used that as well. So when we're using EMDR in a future template for things like Brazilian Jiu-Jitsu, we picture that event in our mind, we're on the ground rolling with the opponent, we're anticipating moves, and we work to strengthen those neural pathways so that when it comes time to actually execute, we can do that successfully without any problems. In the Navy, we call this chair flying. It's a preparation that you actually do physically and psychologically preparing for the next flight, so this is not uncommon, but it's an exceptional trauma treatment. EMDR can work wonders on a number of other issues, including chronic pain and disease management, as well as performance coaching. To learn more, you can go to emdria.org at emdria.org to find a provider directory, to access research articles, to learn more about EMDR and the benefits that it can offer you. Hope that helps. Take care. So part of my job is to help you all get unfucked, but if you're curious about how fucked you actually are, you can go online and take the FUBAR assessment at laurenrich.net.